everyone. Today let's talk about ondansetron, a very commonly used anti-emetic. Emetic meaning anti-nausea and vomiting. The trade name is Zofran. So what are the key points, the NCLEX points that you need to remember? Zofran or ondansetron basically goes and blocks the serotonin receptors and therefore gives you relief from nausea and vomiting, especially for those undergoing radiotherapy, chemotherapy, or it can be also used post anesthesia, that is anesthesia induced nausea, vomiting, and at the same time it is considered safe in pregnancy, that is the hyperemesis gravidarum, the first few months, nausea, vomiting in pregnancy, and similarly it can be also used for minor viral gastritis in children. You can give it depending upon the urgency and the situation. If you want immediate relief, give it IV, administer it IV. Or we can do IM, which is slower than IV, that is intramuscular. The fastest is going to be IV, direct, okay, intravenous. Now, if the patient is throwing up and is not able to swallow a tablet, or you can give it sublingually, that is just the patient can just take that tablet, keep it in the mouth, allow it to dissolve on its own. Within 5 minutes, it will just dissolve on its own. You don't need water. Okay, so this is for those who cannot swallow because there is severe vomiting. And lastly, we can give it orally in the form of a tablet, which can be swallowed if it's not an emergency and the patient is at home and she's not having that frequent nausea or vomiting. Now, the key other NCLEX points are ondansetron, like I said, use it if you're giving it for chemotherapy. Give the medication at least 30 minutes before starting chemotherapy. Only then the effect would be there. Okay, so it should be given at least 30 minutes prior. Similarly, other things we need to look into is if the patient has very poor hepatic function, liver function, don't administer the drug or don't give more than 8 mg per day. If the patient has poor liver function, take the baseline ECG because it can prolong the QT interval. So, if the patient's QT interval is already prolonged or the patient is taking other medications which can prolong the QT interval, for example, certain antibiotics like azithromycin, ciprofloxacin, then that can cause drug interaction, also avoid. Okay. The adverse effects, side effects include the common ones are dizziness, so avoid running heavy equipments, machinery or driving, and less common but important ones are Stevens-Johnson syndrome. It can also cause pruritus. It can cause diarrhea. Okay. So these are the important adverse effects, what you have to watch out for. Two things which can be which is rare, but it can cause serotonin syndrome if it is taken with other serotonergic drugs like antidepressants. And serotonin syndrome, you all know, hypertension. So it is an emergency condition. Okay, so avoid taking it with other serotonergic drugs. Lastly, avoid taking this medication when people with phenylketonuria. It's a genetic condition. So those who have phenylketonuria, don't give ondansetron. Thank you.